All right, this is going to be a video just showing a few exercises to deal with usually what people refer to as sciatica. There's sort of a technical definition and a breakdown of what sciatica actually is. People talk about it more colloquially, so it sort of depends on what the source of it is. The sciatic nerve travels around, basically in the space between the tailbone and your hip bone, through the low back and down the back of your leg. And what happens is a lot of times, especially if you have a disc that flares out, that can compress the sciatic nerve. If your piriformis muscle, which goes in between the head of the femur and your tailbone, if that tightens up, that can actually compress the sciatic nerve. There's also a problem with spinal stenosis, a bone degradation, and there can be a lot of things going on. Now, if your symptoms aren't totally severe and you're not totally losing sensation in your leg, it's good to just mess around with a few exercises. You may be able to get a light flaring of this to just back off a little bit. And if things are all debilitating to the point where you can't feel your leg or you can't move or the sensation is traveling all the way down to your foot with no relief, you probably need to see a professional, keep in mind, and get a better diagnosis. But to play around with this here, just to see if you can take some of that pain out and some of that restriction out, just a few ideas to throw around here. All of these may not work. You may find that one or another actually does provide a lot of relief. So just play around and see what you can do here. You can move around within some of these positions. Some of them I'm going to recommend maybe taking them back and forth, in and out of whatever position we're taking it to. Some of them you just want to hold for time. The simplest thing, because a lot of times, just from sitting, basically you can have a lot of pain in the low back with the disc is slipping out, and this sort of depends right here. But one thing to start is basically in a prone position, and maybe bringing some pillows underneath you just to support this here. But see about bringing yourself down, especially if you felt that sort of sciatic pain lighten up after you've been sitting for a long time. Maybe coming down, having some sort of support like this, and you can bring yourself up higher, you can come down lower, but then just go ahead and let your feet just sink down and let yourself round over some sort of padding, some sort of pillow. You can always also put something on your head, and you may find you get some initial relief from this right away. And if that is the case, to give yourself maybe a minute in this position, maybe a little bit longer, just to settle in, and then start to experiment with a few things. Now, if you have something going on with the piriformis and you want to see about getting some relief this way, you can bring one knee out to the side and just go ahead and sink down. And with that knee coming out to the side, it's going to help to just relax any of those muscles in the outer hip around the piriformis, if that's what's actually pressing into the nerve. And you may find a good amount of relief this way. You can make this a little bit more active, maybe lifting up and down and then settling in. And that's one place to start. And so it's not very active from the beginning, keep in mind. Now, if you find you may need to take things a little bit further, and sometimes coming up and down into basically what's a lift into a cobra pose like in yoga. You do this with your belly on the floor. Keep your legs down. Be sure your pelvis stays down. And you can go in between just lifting the upper body without your hands on the floor, and this engages your low back and really engages the extension of the spine rather than the flexion. And just holding on to this, you may find some relief. It's easier if you have your hands down underneath the shoulders, maybe a little bit behind, but pressing your hands, keep your elbows pulled in. And then just take this up and down, maybe 5 to 10 times, and just go back and forth. To engage it further, you can kick into the floor. Keep your hips grounded. You're not trying to lift your hips at all. And after you're taking this back and forth, try to keep the muscles in your low back engaged, engage the glutes, and maybe press up a little higher still. You can also bring the hands further forward for more of a base, but again, keep your pelvis down on the floor. You're not lifting from there, you're just trying to lift from the low back on up, and then just see about holding on here, or maybe bring the hands further forward. You can come up a little bit higher for a longer hold. And you can go in and out of being active in this. And more active is pressing your hips down, kicking into your feet, and pulling your chest forward. More passive is just letting go of that sensation, just using your arms to prop yourself up. And you may find some relief holding here after you've gone back and forth, lifting and lowering. I recommend lifting and lowering maybe about 10 times. And you can bring this back down. And maybe one round of that is enough. Maybe you take a few rounds and you're able to get further each time. But play around with that and see how far that can go for you here. Now, another way to engage this, and depending on where any sort of impingement might be, anything that's compressing into the nerve, you can do a variation of this, which is more of a banana shape. So rather than just having my body in one line, or just long in line with the mat right here, I'm going to bring my feet over to the right, and bring my hands over to the right. So I'm bringing my body into more of a banana shape. And I'm not going to be able to raise myself up as high as I did before, but you still want to press your feet into the floor, and you're bringing your spine out to the side, because sometimes the compression can be one side or another. And then again, just lift up and come back down, and lift up and come back down. And keep your pelvis down on the floor as you lift and lower. Use the muscles that line your spine to help lift this. And put as much weight as you need to in your hands. And as you take it back and forth, you may be able to hold this up higher. And obviously you're going to be turned to the side. You're probably not going to lift as high as you did with the other variation, just straight front to back. And that's one way to play with that sort of lift. And you can bring that back down when you're ready. Now, another way to work on this is basically on the side of your body. So I'm on my left side. I've got my right foot forward to the left, so both feet are on the floor. I'm going to have my right hand forward. So I'm just lengthening out my left side toward the floor right here. So the idea is any sort of sciatic, any sort of pain that I'm feeling as sciatica is mostly on the left side and traveling down the leg. And give it a try from here. So you start with your hips down on the floor. You're finding that lengthened shape. And then see about suspending yourself in between your feet and your hands. And maybe take this back and forth, just lifting and lowering a little bit. And then see about just hanging on to this and letting your spine lengthen out to the side. You may find it's effective as well to bring your arm out to the side, both hands down. And then maybe bring the forward hand in closer and see about lifting here. And just keep enough tension, or keep the activation through the arms. So I'm just keeping this straight. And you can just keep your hips down like this, keep your legs straight. Maybe lift and lower a little bit out of this. And you can just hold at any point where you really start to feel some relief. And then go ahead and bring it all the way back down. And there's ways to play around with this, keep in mind. There's no just one perfect way to do this. You're just playing around with positions and seeing if you do find some relief in one or the other. All right, and one more thing that may help out, and the idea here is to find a way to help yourself traction your spine. So I'm going to grab a couple boxes that I have here, and ideally I would have something a little bit higher, but I'm just going to bring these in, and they give me enough height that I can have my hands on the blocks and get my feet up off the floor, and just use this to let my hips hang so my spine can lengthen out just with the weight of my lower body. So I'm going to bring my hands to the blocks and put all my weight to my hands. And I'm going to keep my feet on the floor, but I'm going to take the weight off my feet. So you can see I'm able to move my toes here. Now, you want to keep the lift through the shoulders and just let your body hang in between your arms. And as long as your arms are straight, this is going to be some effort, but you don't need an unreal amount of strength to be able to do this. And maybe just holding this for time helps out. And you can play around with walking your feet forward. This is going to tip your pelvis back. You can walk the feet back, that'll tip the pelvis forward, and you may find one position or the other helps to give your spine some relief, but your spine's going to lengthen out here because there's not a lot of compression. Everything's just hanging, and the spine starts to lengthen just through the weight of your body. But again, stay light in your feet. You can put some weight on there if you need to. And just to see that from the side, I'll turn the boxes this way. Again, you just want something that's high enough to support yourself. You use a couple of chairs, you can use a couple of tables, whatever's around. And you can also hang from something above your head, with your arms straight and the shoulders pulled in, then your whole body hangs from there. But again, for me, I'm just going to have my feet on the floor, but I'm taking my weight on my arms. And keep this upright rather than sagging from the shoulders. Be sure you lift and keep your neck long. Let your hips just sink down. And there's no weight on my feet. I can still move them here. And again, you can keep the pelvis tilted back with the feet forward, or you can walk your feet back and then the pelvis tilts forward. And you may find one of these positions or something in between helps give you some relief. And just holding this, say for 30 seconds to a minute, maybe longer if you like, or maybe just going back and forth and coming into this position when something starts to light up will give you enough relief from that sort of pain to make whatever you're doing more tolerable, especially if you're spending your time at your desk all day.